will cover stem cell basic research, translation, and clinical application. It will highlight the latest stem cell research in the world. And we will try to talk about the different sources of stem cells from the placenta, the cord blood, and the bone marrow. And the most important aspect in the field of stem cell transplantation. Also, we will try to cover the compatibility between the donor and the recipient for HLA typing. We will talk about stem cell and different diseases like cardiovascular, hepatitis, diabetes, and of course blood diseases. This conference is very important because we are hosting very experienced scientists and clinicians in the field of stem cell therapy. We have 25 speakers, both national and internationally. We have our experts in stem cell transplantation from the US, Canada, Spain, Italy, UK, and Germany. And this will give us the opportunity to actually network with these experts and to share information, to give the chance for our own national scientists to discuss, share information, learn, and get the experience from these expert speakers. I'm sure, especially our junior and also our very experienced local scientists, they will learn a lot and they will gain a lot of benefits from this conference because they will have the chance to actually talk face-to-face to these experts and use this for their future plans and clinical application that they want to use for their own research. I will really hope that everyone will try to attend as much as possible and get the opportunity, be proactive during the meeting, try to ask a lot of questions, not be shy, and taking really part of this conference. Yeah, so I'm mainly focusing on stem cells from cord blood. I'm the director of the cord blood bank, which we have started in 2010. Actually, we are storing cord blood and collecting from stem cell from cord blood after deliveries, and we process them, we freeze them, and we use them later on for patients who might need stem cell transplantation, especially for blood disorders and cancers. Cord blood stem cells is a very important source of stem cells. Why? Because it is painless, it is easy to collect, and has no pain, and we can just store it and use it anytime we need it. So it is much more easier than bone marrow stem cells because it is kind of like off-the-shelf source of stem cells. Cord blood stem cells has been used to treat many hematological disorders, and it is also very good because it requires less HLA matching, so it has less GVHD effect on recipients. This stem cell conference is a series of conferences. The first started in 2012, and our second was in 2014, and this is the third conference. And it is very important because it is the only one, and it's the leader that actually talks about stem cell field in this big aspect. This conference will cover mainly stem cell from mesenchymal stem cells from the placenta, and there are different uses and to treat different or variable diseases. Also, it will cover cord blood stem cells and how what are the latest in cord blood banking and clinical application. And also we will cover clinical application and the clinical use of stem cell from all these different sources. Of course, there is a great collaboration between the National Guard Hospital and all the other local hospitals within Kingdom of Saudi Arabia. and this will help and benefit our patient, and we feel like more like a group or a family in regards to stem cell and treatment of patients. I really hope that everyone specialized in this field would do their best to attend this meeting, to have a proactive interaction and to learn the best and get the most out of this conference.